To date, over 100 rheumatic diseases are known, and the number of patients affected by such disorders is more than 300 million all over the world. Among these, 14 million patients have a diagnosis of rheumatoid arthritis. The most frequent symptoms are pain, which can appear in various ways, and a reduced joint functional capacity.
It is possible, as a patient with arthritis, to have concerns about which is the right path to follow or what the best course of action is. They may wonder, what is happening to me? What future will I have? Who can answer my questions? It is especially difficult if their joints have been painful for a while, impacting their mobility as well as sleep. This element can interfere with everyday life, both with family and the ability to work.
Rheumatic disorders are the second most frequent cause of disability after cardiovascular diseases. Their economic and social impact can be high for both the individual as well as for the society. These costs can be either direct, that is, hospital admissions, diagnostic investigations, drugs, rehabilitation, etc., or they can be indirect. This could be lost working days, disability, and other things. And in fact, the indirect costs are twice as high as the direct costs.
Arthritis usually has a chronic progressive trend, which can result in a disability. Its onset might appear in many different ways. It can either be sudden and acute or slowly progressing through time. Regardless of the cause, research has allowed us to move forward in order to have a better grasp of its development and the ways through which it can manifest. Such elements are important to find better therapies as well as properly improve the prognosis of those with arthritis.
As of today, in addition to a more in-depth knowledge of arthritis, early diagnosis is easier thanks to the advancement of technology with more specific laboratory tests and better imaging exams such as radiographs, joint ultrasound, CT and MRI. An early diagnosis of arthritis is crucial since treatment should start early to improve its prognosis and consequently the quality of life.
Patients and physicians should discuss together about the fundamental information on the disease, the treatment possibilities and lifestyle adjustment needed. Drug therapy has changed dramatically over the past few years. In addition to treatments aimed at relieving pain, there are several types of drugs available that can change the natural course of the disease. Their goal is to slow down or stop the disease by preventing the joint damage resulting from the inflammation.
Other therapies are also associated to the drug treatment. This includes rehabilitation, the use of aids, and the adaptation of the surrounding environment to maintain the meaningful activities of the everyday life. For example, lifting a pot, doing the chores, performing personal hygiene, getting dressed, continuing hobbies, and so on and so forth. This may allow individuals to maintain or regain a functional autonomy despite the presence of a significant disability.
Ensuring individuals with arthritis are adequately informed is one of the most important aspects of a successful treatment, including information regarding the nature of the disease, its possible cause of evolution, and the types of treatment. It is also important to discuss together the goals to achieve. It may not be easy to accept the diagnosis of a chronic disease, particularly when it might induce important limitation. Its psychological impact can be significant. Anxiety during routine appointments, concerns when a drug that might not give immediate relief, uncertainty of their future, and so on.
Therefore, ensuring rheumatic patients are cared for holistically through psychological counseling in parallel to the treatment of the disease itself is very important. A better understanding of the disease, the possible futures they can have, the treatment available, with neither false hopes nor catastrophic scenarios, could help people with arthritis to move forward.